Well, I think that we are live. Hey guys, this is Jessica Ortner, and I'm doing something I've never done before, so fingers crossed that it goes well. I am recording. Oh, hold on one second. Okay, here we go. Now I'm on it. All right, so I'm doing something I've never done before, which is record a podcast on Facebook Live. Many of you follow me over on iTunes. I have a great podcast called Adventures in Happiness because in this day and age, being happy is definitely an adventure. And I'm committed to share with you the latest information around health and wellness so you can live the happiest life. I am so excited to have today's guest, and we're going to be talking about a really important topic that sometimes makes people uncomfortable, which is the topic of depression. Let me share a little bit about our guest. So Dr. Kelly Brogan is a Manhattan-based holistic women's health psychiatrist, author of the New York Times bestseller, A Mind of Your Own, and she is the co-editor of the landmark textbook, Integrative Therapies for Depression. She completed her psychiatric training and fellowship at NYU Medical Center after graduating from Cornell University Medical College, and she also has a bachelor's from MIT in systems neuroscience. She is definitely a smarty pants, and I'm very excited to have her here. Kelly, thanks so much for being with us.
I'm so happy to be here with you.
Well, this is a big topic. I mean, I was really surprised when I read your book to read that 11% of Americans are on antidepressants. And one of the things that you share is that you used to give people, your patients, antidepressants. Can you tell us a bit about your past and when you began to realize that something wasn't quite right?
Yeah. So it's actually now, since we published the book, 16% is the updated stat.
Wow.
Yeah, which is interesting. So, I think it's, I don't know, it's allowed me to see things through a lens that I think many conventional doctors wouldn't have available to them if they didn't have a health experience that woke them up to a broader version of the truth. So I was not like raised a hippie. I was not raised with any, regard whatsoever for alternative medicine. And I went to medical school because I worked a suicide hotline actually at MIT, where suicide is actually a big issue. And I was supervised by a psychiatrist, and I just was left with this impression that we've cracked the code on human behavior. We know how to help people, we know how to end suffering, and we just need to give them more access to medications. And I want to help, I want to help in that regard. Yeah. And so I went to med school to become a psychiatrist, and it wasn't literally until I had my own health crisis, which began around diagnosis 9 months postpartum of Hashimoto's thyroiditis, which is like an autoimmune thyroid condition, that I basically encountered this deep inner voice that said, I don't want to take a prescription for the rest of my life like all my patients do. That's not for me. It's fine for them, which is this sort of weird hypocrisy that unfortunately a lot of physicians find themselves engaging in. And I went to a naturopath. And so I put my Hashimoto's into remission in the space of 9 months. And I've always been a science nut. I've always been really comfortable on PubMed.gov and deep in statistics. And I just switched gears and I said, okay, so I want to learn what else I wasn't told about in medical school and training, including the fact that food has anything to do with health and chronic disease. We literally don't get more than 1 hour of nutrition training in an entire decade of, our education. And I didn't learn that you could put an autoimmune disease into remission. I didn't learn that chronic disease ever had any other course beyond maintenance. And so it was through my exploration of the scientific literature obsessively over the next couple of years that I began to discover a lot of things I wasn't told about different classical medications. So from birth control to acid blocking drugs, antibiotics, and of course then zoomed in on my own specialty. I was given, the way the universe works, I was given a book called Anatomy of an Epidemic by a colleague of mine who is a therapist. And she said, what do you think of this book? You prescribe all these meds. And because I had just had that healing experience of my own body, I read it. And it changed my life completely. In fact, I put down my prescription pad and never started a patient on medication again, ever since that time. Why? Because I really was able to hear what Robert Whitaker, who's an investigative journalist, what he was trying to say. And what he was exposing was the fact that we have been prescribing more and more and more and more medications. But so then why is it, Manhattan?
This is what happens when you're live.
Exactly. So why is it that there is more and more and more disability secondary to mental illness, right? Like, shouldn't we have more treatment and less disability? Shouldn't it be making things better? And is it possible?
Wait, so you're saying that as time went on, we were getting more drugs, like more solutions, but it didn't actually show with people getting better.
Exactly. That's exactly right. So that today, according to the World Health Organization, the number one cause of disability in the world is depression. And we have more and more people being treated. So is it possible that actually the medication-based intervention is not helping? Is it possible that it's actually making things worse? Like, that's a really controversial statement. And I had to dive into the research literature myself to be able to understand how I personally could have started, I don't know, a couple thousand people on medications myself, thinking it was the right thing to do. And that's where I always default to one of my favorite quotes by Maya Angelou, which is, when you know better, you do better.
Right.
So, if there's anything in this conversation that happens to sort of stir a truth inside anyone listening, then it's just potentially the beginning of a new way of, moving forward.
Right.
No
so,
judgment.
Let me ask you about this knowing better, because if you go out and you speak to anyone on the street and you ask them what depression is, they tend to tell you that it's something chemical. They all know the word serotonin, and now there's a lot of research coming out with a new understanding of what depression really is, but there's this really big gap that you explained between when a scientific research paper comes out and it actually gets into the hands of a therapist. Can you kind of talk us through the research and kind of where we are and what we're beginning to understand about depression?
Yeah, exactly. So that gap, according to, statistics, is 17 years. So in your life, that's a long time to wait for science-based medicine, right? And so, the most important premise is to understand that, unlike many other disciplines in medicine, psychiatry doesn't have any objective tests. So you don't go to your family practice doctor or your psychiatrist and get a brain scan or even a blood test or an EEG. It's just a conversation like what we're having. And so it's a subjective label. And so we need to acknowledge that all of these mental health and mental illness labels are not actually disease entities in the ways we might want to think about it. And trust me, I was trained literally to tell patients, taking your Prozac is no different than a diabetic taking insulin. But it's not true. And part of the reason it's not true is that depression is not one thing. So I like to encourage people to think about it like a fever. So if you have a fever, that your body is dealing with something, but you don't know what it's dealing with, and you don't necessarily even know what would be the best course of action in terms of helping your body to deal with it. You have to dig deeper, right? Investigate further. And so, depression, what our best understanding is based on 20 years of literature, so this again isn't even new stuff, is that it is a reflection of a bodily response. So the language for a bodily response is called inflammation. Right. So inflammation we think of as like such a bad thing, but it's not a bad thing necessarily. It's a sign that your body is responding. So what is it responding to? Is it responding to psychospiritual stress that is chronic? Are you in an abusive relationship, at an unsatisfying job? Is it responding to a toxicant exposure? Do you have mold in your walls? Or did you get exposed to a medication that is actually driving an inflammatory response, like birth control, for example? Is it that you have a nutrient deficiency like B12 that is making it very hard for your body to regulate its own detox mechanism and is driving inflammation? Could it be an autoimmune condition? It's no accident that I learned a lot about thyroid and its role masquerading as a psychiatric illness that is really, immune based. And so we need to dig deeper beyond the label to understand what it means for you. And the good news is that, in my opinion, it is always, always, always reversible if you believe it to be. So that I have come to the conclusion is actually the most critical ingredient. So that's why I say, while we're talking, see how this information feels, right? Like if it feels like there's something to it, don't worry so much about the details. Just know that there is absolutely like a path forward that involves, a radical experience of healing that maybe conventional doctors don't know is totally possible.
Right. In a moment, I want to talk about some of the trigger foods that you have seen that can contribute to depression. But first, I just want to share a really quick personal story, which is why I'm so excited to have you here. As you know, I wrote a book about tapping for weight loss and body confidence. And my struggle with my body was like my big pain. It was like, it started when I was 15 and it wasn't just the weight. I just wanted to crawl out of my skin. I didn't like being in my body. And I would do like diet. And no matter how much I dieted, I wouldn't lose weight, or I'd lose some weight and then I'd gain it again. And it was just this horrible pattern. And so, as many people know, that's when I decided, like, I'm tired of this fight and I want to do something radically different. And I started to just look at my emotions around food, my emotions around myself, my self-worth. And the moment I took that approach and I dealt with the emotional aspect of it, it's like I didn't even have to be as strict on my diet anymore. My body just started responding better. So definitely, like, that's a huge component, but something else came up, which I was not expecting. And that was that when I was very clear on my emotions, and because I was tapping, I was very aware of myself, I began to notice that certain foods had impact on my moods, which I'd never noticed before. And I noticed that every time I had gluten, I just like hated the world. I don't know how else to say it. I would have like a piece of bread and I would just feel irritable, and I never made the connection. I thought it was just because I didn't like my body or I didn't like who I was. I had all these stories about why I wasn't feeling good. So just with that, just because I noticed I wasn't feeling well, I stopped. And it's interesting because I have not had gluten for like 3-4 years. And people ask me, do you have celiac? Yeah. And I'm always like, no. And they say, well, why don't you eat gluten? And I usually I say, oh, because I have like a skin reaction or it's digestive, which is like true, but they're really minor. It's just, I never wanted to say, I think it makes me depressed. Like, I think it gives me really low lows. And then when I picked up your book and read about it, it was so rewarding to notice something intuitively, to notice something about myself, and then to begin to see that, yes, there's been research around this. Yeah. So can you tell us about these trigger foods?
I always say that's what I'm here to do, is just get in the corner of people who already have come to this intuitively, right? So to just show you that there's actually all this beautiful science to substantiate your intuition. I just love what you described, because that's really the goal for all of us, is some sort of reunion with our body where we begin to understand its messaging, where we understand that our body is on a journey. We're just here to witness it and support it. And that's, exactly what you described. Most of the women I work with have to have a sort of like a container, that I help to create with a certain set of like structured rules in order to get clear enough to begin to hear and read those signals. Mm-hmm. But what you're saying is absolutely true. I mean, I think it's intuitive for a lot of us that the brain talks to the gut because we've had, diarrhea when we're nervous, or we've lost our appetite when we fall in love, or, we get that. But actually, for a number of decades now, there's an incredible body of literature that talks about how the gut actually impacts the brain behavior, mood, cognition. And we have a better understanding of how that happens, and that it's real, and the details of it even, and the role of the immune system. So, there are certain foods that I ask people to explore their relationship to, which is a nice way of saying to cut out for a month. And I chose them because of the science that exists that suggests that these foods for certain people can push and pull on their mood and cognition. I mean, there is a case report I published in wrote a blog about, of a 37-year-old woman. This was in the New England Journal of Medicine, who literally was so psychotic that her family took out a restraining order on her. She was admitted psychiatrically. She was treated with Zoloft and Risperdal, so 2 medications. They didn't really help. She was then transferred to another hospital, and finally there was a workup of some of the physical symptoms that she had, like weight loss, for example. And she was diagnosed with Hashimoto's, and she was diagnosed with celiac disease. And so they put her on a gluten-free diet, and she was completely normal and back to her baseline within 2 months. So this is how much it can affect. It's not just like, oh, maybe I feel a little foggy. Sometimes it's that, but it can be that dramatic. I mean, there are actually over 200 abstracts on the link between schizophrenia and wheat alone. But what's been confusing for a lot of people is that they intuitively observe what you observe, but then they say, oh, but I'm not celiac, so like it can't be real.
I know.
Yeah, so that's where actually, again, science has your back, because your favorite doctor might not know this, but there are a number of studies looking at something called non-celiac gluten sensitivity. And this is to acknowledge that even without the stigmata, of celiac disease or the formal criteria for diagnosis, which is normally arrived at through a small intestinal biopsy, what you're experiencing is real. And it's particularly real around mood, such that some very high quality studies have been done, like what are called crossover trials, or, challenge and re-challenge studies. And it's very clear that there is that connection. Right. So to me, when I look at eliminating gluten for a period of a month, you're not really giving much up, right? Because it's almost always a processed food. It's almost always like with the accompaniment of like GMO oils and sugar. And so it's not like you're giving up health foods necessarily. You're giving up a lot of processed foods. So there could be a lot that goes with it, that exits with it. I also asked people to give up for a month dairy. This was the hardest one for me because I was raised by an Italian mom, and I literally ate bread and cheese in some variety for like, I don't know what it was, 25 years of my life, every day, 3 times a day. So, these foods, we actually understand how they can be addictive. We have a mechanistic understanding of how bread and cheese, for example, literally can plug into reward centers in your brain in a way that like broccoli doesn't. Right?
So unfair.
So unfair, I know. And all of it is just in the service of understanding what it does for you. So I asked to cut those things out. Then I asked for people to cut out some specific starches, not because they're bad, but just because we are learning more about the ecosystem in your gut and the bacteria in your gut, and they love these starches. So things like white potatoes and grains and legumes like beans. And you just want to have a clear picture. So to read those signals that you ultimately were able to read and understand, is your gut ready? Is it healed enough to be able to eat those kinds of things? Most of the time, in my experience, it is. But we want to sort of regulate for that initially. Then we're cutting out processed sugar, which is hopefully no one needs a primer on why sugar can be a problem, but you might not be able to appreciate how much of a problem it can be, that literally it can drive diagnoses of ADHD, panic attacks, chronic fatigue. It can literally be just processed sugar in your life, which is sneaking in all sorts of places, including like salty snacks. They're putting right. Sugar. Then the big ones for the women that I work with, and I totally get it. The biggest one is probably coffee. I practice in Manhattan, where everyone practically has like an IV infusion. I joke that when I do workshops and stuff, it almost feels like I'm running like a 12-step program for coffee addicts. It's so much a part. It's not only the effect of the coffee and the punch to your adrenals, but then it's a conditioned response. So it's like Pavlov's dogs, So I actually think that's why decaf doesn't make so much sense to me, because your body has learned how to recruit all of its fight or flight chemicals that it possibly can muster, the moment you smell and taste that beverage. So, I ask people to stop that and to stop drinking alcohol, again, just to explore your relationship with it, because after the month, if you feel so inclined, you can reintroduce it. But almost always there's such a shift in clarity, in energy, in mood, in stabilization of things like, hunger, endless hunger. So you want to sort of get that physiologic base in place first, so that you can do maybe the deeper psycho-emotional work that, comes with everything that you represent.
Yeah. One of the biggest questions I get when someone finds out I don't have gluten, they're like, their first response is like, oh, you poor thing. Like, you can't, like, this idea that somehow by not having to have, like, be able to have any cake you want, you lack joy. So it's this feeling like, well, if I don't eat these foods, then I'm not really going to be loving my life. I feel like they might not say it like that, but I think that's what we're trained to feel. And the difference is, the reason it's so easy for me is because I finally made that connection that it doesn't actually bring me joy, like, at all. I'm so much happier than I've ever been before without having to get the grocery store cake. You know what I mean? Like,
100%.
But you can't get there until you feel it for yourself, because you can have so many people tell you not to eat certain things, but you have to do it yourself. And that's why I like that you're calling it an experiment to figure out, does this really work? But I will say, in the beginning, it was very hard for me. So can you talk about the detox side of letting go of these foods?
Yeah. So I love what you're saying, because that's exactly what I'm going for, is a felt bodily experience of this kind of freedom, that you're describing. Because you can't, I like to talk about science, fine, but nobody actually changes their life because of science. It just doesn't work that way. You need to have a feeling of it. And that's why it's like, if you burn your hand once, you don't need to constantly tell yourself, don't touch the flame, don't touch the flame. You just know, your body just knows. And then all that energy is freed up, and you actually just intuitively move through the world, where you don't have to constantly use your mind to navigate. Right. And that's so much of what, where our missions are so aligned. But it doesn't mean it's easy. Okay. So the first 2 weeks are the hardest part. And it depends on what you've been eating. But if you've been eating the way most of us have been told, like, oh, it's not a big deal, everyone's fine, like, just stop being weird and eat what everyone else eats. If you've been living that way, then it could be that you have like 10 to 14 days of, literally, it has different names. It could be called the carb flu, or, it's, different kinds of sugar detox, but it can look like literally aches, fatigue, tremendous fatigue, headaches, and irritability for a period of about 2 weeks, but it passes. It completely passes. And then the next 2 weeks are where things really start to emerge and become clear. And the reason I feel so passionately about this, maybe once in a lifetime experience that you give yourself as an adult, is because the baseline that you can reach is one that you generated all yourself. You didn't have to go every day to an appointment. No, this is all your lifestyle changes. You are in charge. And then you get to see, like, do I really have insomnia? Like, am I really an anxious person? Like, do I really struggle with memory? Because by the end of even just that month, you might find that you don't have acid reflux you thought you had, and you were taking a supplement for 5 years. So it's just getting very much down to a baseline understanding of what you look like without these potentially influential exposures. And then you can learn for yourself, if you reintroduce them, how obvious it is that, it's worth, living a freer life the way you're describing.
So it does seem like in the beginning, when we want to have this experiment, that it takes some effort, right? And we so desperately wish that there was a pill. I think everybody wished that we could just take a pill and feel better. And so I can see the conflict, because here we have someone saying, well, just take this pill. And now the other side definitely takes a lot more work, a lot more personal work. So talking about an antidepressant and looking at it in the long term, like, what are some of the long-term effects for people who begin to go down that road or on that road?
Yeah. So this was a really, really big leap that I had to make once I was able to look with clear eyes at what the literature has to say about antidepressants, because as I mentioned, I had prescribed them for many years. Not only that, but my specialization was actually in pregnancy and postpartum. So I was prescribing these medications to pregnant women specifically, and breastfeeding women. So you can imagine that, what I'm about to describe was jarring for me, and it may be for, some people listening. Trust me, I get it, but it's all in the service of trying to get the fuller picture than what our current system is set up to inform us about. And that's sort of the beautiful time that we're in, is that we can learn this on our own and make our own informed decisions, even if our prescriber doesn't have the full story. So, when it comes to antidepressants, again, we want to believe that they are specific chemicals having a very specific chemical rebalancing effect, and that they're correcting a problem. And that is like a really nice idea. It feels good. It feels simple. It feels
a cute little package.
It's a nice little package. But there is literally, in 60 years of medical literature, not a study to substantiate that claim. So
really?
And this is not my information. Like, I am the messenger. There are some intrepid psychiatrists who came before me, like Peter Bregan and Joanna Moncrief, who have been, screaming from the rooftops about this and saying, the serotonin theory of depression is a total myth. And then, you can read all of these quotes from people at the National Institute of Mental Health, like scientists saying, stop with this. Like, it's not actually a valid statement. And the pharmaceutical companies are allowed to advertise. We're one of 3 countries in the world that allow them to advertise directly to consumers. And they are allowed to talk about these ideas, that there is a rebalancing happening of your serotonin. So what we've come to understand is that
with cute cartoons.
Exactly, with little bubbles coming across the synapse. And it has an impact on us. And it has such an impact that then when subjects are enrolled in trials and they are told, okay, we are studying a new antidepressant, you're either going to get the sugar pill or you're going to get the antidepressant. They know that antidepressants have some side effects, dry mouth, they've seen the commercials, etc. And so when they're in this trial and they start to feel those side effects, they say, oh yes, I'm in the treatment group, like my chemical imbalance is being resolved. And this is called the active placebo effect. It's a real thing. It doesn't mean they were fooled or duped. It's a physiologic thing that happens, and they actually do get better for a period of time. And it has nothing to do with any mechanism that the pill is exacting on the body. And this has all been borne out in very controversial literature, a lot of which was collected by a researcher named Irving Kirsch, who's arguably like the placebo effect expert in the world. And what he found is that these meds are not working for the reasons that we think they are. And, what happens is that we study them for 6 to 8 weeks, but then people go on to take them for 10 to 20 years. And none of that is based on evidence. And in fact, the evidence is to the contrary. All of the naturalistic evidence, which Robert Whitaker has exposed and did in his book, shows actually that you're better off not taking it, that the long-term outcomes are that people who take them long-term have higher rates of disability, not meaning like, they become injured, but that they don't, some weirdly sort of fall out of functioning, like I have a patient in my practice who was on, I think for 21 years, antidepressant. And she started off the journey as an architect, and now she's been unemployed for 6 years. She's like, totally fine. There's no real explanation. And there are some theories about the cognitive dulling that can happen over time. But the truth is, it's really the Wild West. And we don't know what most pharmaceuticals do long term. That's not what they're designed for, because the trials are short-term trials. And it makes sense that no one would ever really come off them, because why would you not need it? What have you done or been encouraged to do in terms of resolution of the reason that you were on it in the first place? And that's why before I engage anyone in a medication taper, which is now what I do for a living, I make sure that we are addressing detox, meditation, diet, that we are addressing all the potential root causes at once so that you're not left with the reason you went on it in the first place as you come off it.
Right. So just to be clear, if someone's on an antidepressant right now, the last thing you want them to do is just completely stop.
So not only is it literally the last thing I want them to do, but I need it to be like in neon lights that there is an order of operations. And the first thing that happens, so I do not taper 1 milligram of a dosage before we begin the healing process. It's because I learned the hard way, because after I read that book, I went into my practice and I said, I'm going to offer everyone in my practice the opportunity to come off these medications should they choose to. And I sort of did what I guess I learned in my training, which is, 25% of the dose a week or whatever. And I was literally running like a hospital out of my, office, because there was so much medical instability that led to almost all of these patients needing to take medical leaves of absence from their jobs. It was such a wake-up call for how challenging it can be to come off these medications. And anyone who has come off a medication, perhaps on their own, and become really unstable, might have been told that it's their mental illness, coming back, or you're relapsing and you see you need medication. I told patients that myself, but it's not true. And now we understand, since 2014, it's been published in literature, that this is a real phenomenon, that these medications are unfortunately habit forming, and they can be quite challenging to come off of, perhaps more challenging than any medications under the sun. And that's why I believe that the order of operations, because I learned the hard way and now I do it differently. And there is a way slowly to ease your body off of these medications. But I will say that I used to be an atheist, okay? I was never not a spiritual cell in my body. And it's been through my own journey, of course, but also my work with these women and witnessing the process of awakening of consciousness that happens during a medication taper, that I now understand to be a necessary element of the mindset transition from this happened to me, it's my bad genes, it's my, life circumstances, it's all the ways I've been victimized, and now there's nothing I can do because my body is broken and I just have to take this med and be dependent on the system for the rest of my life. Shifting from that mindset into a mindset that says, wow, I needed to go through all of this in order to have this opportunity to see things totally differently, to trust my body, to find meaning in all of the adversity that I encounter, to see that there is no good and bad, that there is only experience, and to recognize that I actually am responsible. And so I've been accused of, blaming the victim and shaming people, but I actually think that responsibility is the key to empowerment. That when you say, I made these choices, I made them from the consciousness that I had available to me at the time, and now I'm going to make different choices. And I'm going to move through life understanding that I am always in control. I am always responsible for anything and everything that I experience and my reaction to it. It's a totally liberating way to live. But that mindset shift sometimes requires a bit of a birth canal, and it can be a challenging process, and things can have to fall apart. I'm notorious for the statistic out of my practice, which is that over 98% at this point of my the women that I work with from start to finish end up having dissolution of their marriage. And why would that be? Am I sitting up here like condoning divorce? Of course not. It's because when you make choices from a certain level of consciousness and then you wake up, which I believe coming off of medications is an opportunity to free people from a sort of, suppression of things that they didn't want to look at, to free people from saying no to their felt experience. Because in some ways, that's what medication, antibiotics, any of it is. It's like, whatever's going on in here, no. It's a way of saying no. It's a way of saying this has to be managed and controlled, and it's not okay. And it's no wonder why women are prescribed at double the rate that men are, because our feelings are very threatening. They're very threatening to a society that wants everything to be ordered and, you know, sort of predictable. And the truth is that you know, this feminine sensibility is actually the compass for an entire species, but it's been suppressed. And so there is often a kind of restructuring that needs to happen as you wake up and you look around and you say, gosh, I chose all of this job, this partner, you know, these friends when I was asleep. And now that I am coming into a different space in my life, I may have to shed some of this stuff. And so this is how this process can become quite a spiritual journey. But it's, you know, I've never had a patient come out the other side and say, God, I wish I didn't do that. No.
Yeah.
You know,
It's why I feel like your work fits so well with tapping. Like one of the biggest things that I tap on with clients is always, what's the downside about getting what I want?
yes,
And when it comes to the downside of having to wake up, we know, like we hear this and we think part of us is like, yes, that's what I want. I want a different life. This, I don't feel comfortable in my skin. This doesn't feel like my life. I want to change. But then there's another part of us that's like, but I'm scared because it's so unknown. I'm going into something that like, I don't know what it's going to be like. So it's like the saying, like you rather the devil you know versus the devil you don't know. But with something like tapping, I feel like it can just at least give you that ease. It's always a little uncomfortable because it's outside your comfort zone. But if you find that faith and that comfort within those moments of discomfort, it's like we are led by something greater and we do find more ease.
100. I literally couldn't agree more. It's exactly what you're saying. And that's where it's an awkward thing to realize that we actually sometimes would prefer to be sick, you know, and it is what it is. I mean, we've been conditioned on some level to identify all of the things that are unprocessed pain, all the felt wrongness as being externalized in an illness label. We get to live a certain kind of life, you know, where this society takes illness pretty seriously, right? So if you don't want to go with your friend to a movie, you just don't feel like it. We don't have a society set up where you can just be like, you know what, I want to just reflect and be by myself, and that's what I'm going to do.
Instead, you get a headache.
Exactly. But if you have a headache, you know, everyone gets that, right? It's a currency. And so what would it be like for you to socially not have a currency of health complaints? You know, we barely know how to live without disease diagnoses. So it absolutely is the wild unknown. And there will be clarity, I think, for the people who are ready to make this journey, that you can't resist the pull, you know? It doesn't it's going to be easy, like I said. And in fact, I often point out, you know, that in the DSM, so in the Diagnostic Manual for Psychiatry, which is basically a big dictionary of labels that's ever growing, you know, homosexuality was in this book in the 70s, so you can imagine the integrity of it. But it's in there, a pathological symptom is crying, tears. Literally, it's a criteria of a disease label of depression. And so how far afield, you know, have we been flung when the most human expression is considered a problem? Like we really have to look at it from that perspective, where we are no longer allowed to, in a healthful way, experience sadness, grief, pain, rage. All of these shadow emotions are the necessary complement to joy and ecstasy and expansive states. You know, they come together. We wouldn't know one without the other. And to have the full freedom to experience human emotions is something we need to literally start changing conversations that we have in our society, so that that's allowed, you know, because according to psychiatry today, if you lose a loved one, you've got 2 weeks to get your act together, because if you don't within 2 weeks and you still are really struggling in all of the ways that many of us do in a grief state, you are all of a sudden a candidate for treatment. And the implication is that that's because something is wrong. Remember that chemical imbalance, right? But what if we just need to redefine that grief is sometimes disabling? Sometimes you cannot jump back into life in 2 weeks when you are feeling that depth of pain. So it really does invoke, obviously, much, much bigger systemic issues. But No one has to worry about that, right? Because if you just commit to this kind of compassion for yourself, and commit to a level of self-care that may even be a bit uncomfortable initially, it probably will, then you are one more like imaginal cell, right? Like you are one more node in this, sort of, light display that is, turning on all over the planet, and it matters. Like every single person
Yes,
in this path matters.
it matters. And I think it's important to remind ourselves that the work we're doing goes beyond us. And sometimes it's so much easier to do things for others than it is for ourselves. And so a thought that I would hold on to when I was doing the work around how I felt about myself and my body confidence and my weight was, I realized it didn't start with me. My mother felt it. My grandmother felt it. My great grandmother felt it. This is generations of women who are being told that their worth is dependent on how they look and being perfect and being happy all the time. And here I was trying to, to fit in and experiencing a struggle that has been happening for generations before me. And so when I began to learn about the other side, realizing, oh, this isn't all there is. There is actually a way to feel at home in your body and to feel comfortable with yourself. When I saw that light, one thing I thought to myself was, and I started just this journey in my early 20s. So it wasn't like I was thinking about having children, but it was that idea of, I don't want this. And I know you have two little girls. I don't want this to be part of the legacy. I got this from my ancestors. I want it to stop where I am. And many people who struggle with depression have the same thing. Their mother struggled, their aunt struggled, their grandmother struggled.
And does that mean that it's genetic? That's what we're being told. And it's
right.
a convenient thing for industry to convince the population that something is in fact genetic. Because what does genetic mean? In our understanding, genetic means your thoughts don't matter, your diet doesn't matter, your exercise and lifestyle doesn't matter, your beliefs don't matter. It's just pre-programmed. So there's sort of nothing you can do about it. So you got to just, follow the doctor's orders. But what if what we are calling genetic is exactly what you're describing, which is the handing down of belief systems and the handing down of lifestyles, right? Yeah. So if we all ate a bunch of, garbage, and then we all shared this responsive anxiety, like every time you have a sore throat, you run to the doctor, get an antibiotic. And then we all were sort of like entrained to be very pessimistic and, sort of distrusting of our bodies, then it becomes this legacy. And it's so powerful what you're saying, because we have an opportunity not only to sort of heal ourselves, but to stop a process that otherwise might have, taken on a life of its own.
Yeah, absolutely. Well, I want to ask you a few questions that I like to ask all guests, and then we're going to talk about a special experience we have for everyone that's watching. My first question is, what is something that at the time felt like a horrible experience and it ended up becoming a big blessing?
I love this question because there is, so what my favorite philosopher is Alan Watts, right? And he's this British guy who's unfortunately passed, but I'm pretty sure we were like lovers in a past lifetime, because I hear his voice and it's like something happens inside me. Anyway, he has this narration of this parable called The Chinese Farmer. I don't know if you've heard of it, but it's basically this, Google it, right? Like just check it out, because
Chinese Farmer.
Yeah, Alan Watts. And it's a 4-minute video story of this parable about all of these horrible things that happen to this farmer, right? And his always, like, the neighbors come by and they're like, oh, I'm so sorry. And he's like, maybe. And then something great happens, and it turns out obviously to be a great disadvantage. And they say, oh, this is so wonderful, isn't it? And he goes, maybe. And so I've come to refer to it as the maybe principle. And I think it's one of the most critical perspectives to recondition your psyche around. And personally, I mean, the greatest lesson for me was in the passing of my mentor. I had a mentor named Dr. Nicholas Gonzalez, and he was like Jesus figure to me in my life, literally. Like when I met him, my insides were reconfigured, and my entire life changed just knowing this man. And I had the privilege to work with him for 7 months only, before he tragically passed. And it was totally unexpected. And we had like 700 projects in the works. And we communicated every single day. And he became like a spiritual father to me and someone who made the universe okay. And when he died, I had never encountered that kind of shock, or honestly trauma in my life. And I surrendered in a way. I was brought to my knees in a way that only that kind of pain and grief can do for you. And I began, I had already sort of been in the Kundalini yoga community, but I didn't really have a serious spiritual practice and I wasn't really meditating. Of course, I know about all the literature, 40 years of literature supporting it, but I wasn't really doing it because I sort of was addicted to my own stress. And I got down on my, floor the next morning and I started a pre-dawn practice, because in Kundalini there's some sort of, and many spiritual traditions and religious traditions, like something special to getting up before the sunrise and having a devotional experience at that time. And I started that practice then, and I have not missed a day since. And within 2 months, my entire nervous system was literally rewired. Within 2 months, my life changed. And I have since gone so many leagues deeper in my process, in my potential to impact, the conversation around these issues, and in my own journey as a mother. And it is in direct response to that loss. And so for me to say that, I'm glad that he's gone, of course I can't still, I can't say that. But for me to understand that that was a necessary experience for me to become more of who I am meant to be, absolutely.
That's beautiful. My next question is not so deep. Well, it can be. It depends. It all depends on your answer. If you could be any animal, what would you be and why?
That's funny. Since I was a kid, I've always loved armadillos. I always identified them as like very clearly my favorite animal. And now I wouldn't say that I think of them as being, necessarily like a pet I want to have. But I think part of the reason that I probably identified with them is because I have this and I've been working on it for many years. So you're catching me at an improved state. No, but I have this very hard exterior. I have a big mouth. I have a lot of opinions. I have a temper. I'm Italian Irish, and it's come through and through. And I have a lot of masculine energy, a lot of do it, fix it, don't mess with me kind of energy. And it's been enculturated by my family, and I've taken on this role in many people's lives. And so that sort of hard shell, I guess, is something I identify with. But of course, there's also this vulnerability always. That's a reason for a hard shell, is the vulnerability and softness inside in a way. And so I sort of, I don't know, I feel like it's an important thing for me every day to recognize that that's my work, is balancing out the feminine and masculine, balancing out the yin and yang and softness and hardness. And for whatever reason, that animal invokes that for me.
I love that. What a great answer. So it's a good question, right? You wouldn't think.
It is a good question.
But you get some good answers. So tell us about this workshop that you have. What are we calling it? Workshop? Yeah, it's a workshop. Free workshop.
Yeah. So I, once I started to do this work, and with success, I had a 2-year wait list and in my Manhattan practice. And it was just totally ridiculous because I'm not doing brain surgery in here. I mean, it's really something that is, as I know you all as a family espouse, something that can be handed to the people and the people can work with it. And that's the most beautiful technology there is, because, when you have a medicine, so to speak, that is in your control, then everyone wins, because we can spread it and we can begin to activate and heal more and more people on this planet, and man, is it necessary. So I wrote a book and I developed an online program called Vital Mind Reset, which is essentially exactly what I do in my practice, literally, and then some, because there's, as you know, as you all know the value of, there's an online community, and there are, you know, tools that I've been collecting. In fact, Nick at this moment is recording a teaching for my community, because of how, you know, how much I want to have all of the resources that I value in one place. But I also know that's a big step, and maybe not everyone is ready for, you know, for this moment to be the moment that they take control of their health and change their story. So I've been working over the past 6 months on like, how can I give people a small taste of these experiences you and I have been talking about, of sort of micro healing, like a small taste of how their body can respond in like a week with something very basic. So I have a free online workshop that I'd love to share, and it addresses anxiety, brain fog, and fatigue. Like the most common complaints, I would say, in my practice, the most common issues. And then what I believe to be the number one most critical tool for healing, and sort of how to access shifts around it, which is the mindset piece. And so, yeah, so we're totally excited to make that available to your peeps and their downloads, and sort of, it's very practical, because I can be very up here about stuff, but it's very sort of, you know, in your kitchen kind of stuff.
Well, for those who are watching on Facebook Live, we'll put the link in the comments. And for those of you who are listening on iTunes, you can go to thetappingsolution.com/notes and get that link. Or if you have a good memory, it's kellybroganmd.com/workshop. It's pretty simple. kellybroganmd.com/workshop. Kelly, this has been inspiring and amazing, and I'm grateful for you. And I'm grateful that you shared this with my community. Thank you so much.
Ditto. It's just such a blessing to have you on the path with me, and to speak to your community, because I feel such a synergy, and I'm really super honored. Thanks.
I do too. Thank you so much, Kelly. And thanks everyone for tuning in. Remember, if you like this show, you can also subscribe on iTunes. The show is called Adventures in Happiness. Take care, everyone.